Hey guys, this is Collin with Gordon Physical Therapy. We're starting a little video series about some running and common issues that come with that. Now that people, they aren't able to go to the gym right now, a lot of people are getting out and running, and we want to just go through a couple of things, getting into ways to kind of prevent injury, some things to do as you're starting running as well. Today what I wanted to talk about is cadence, which is one of the most important factors in your running gait. So what I want to start with a little bit is just a little kind of review of some high school physics to go along with this. So every time, I drew a little picture here too, every time you strike the ground when you're running, you have gravity moving through your body, and as you strike the ground, that force that you apply to the ground, you have an equal and opposite force coming back through your body. That force is called the ground reaction force. And that force is the thing that kind of jars your joints and causes issues. It's necessary because it keeps us from falling right through the ground, obviously. But that joint reaction or ground reaction force, when you're running, is somewhere between 2 and 2.5 times your body weight, which is what can lead to some of those joint issues. So when you're striking and you're running, if you're striking out in front of your body, I drew a little picture here, what you have is that force, the ground reaction force coming from the ground, is coming actually backwards a little bit, so it's fighting against your progression, okay? This other picture over here on the side, this person's striking with their foot right underneath their center of mass. So instead of being out in front, it's right underneath, and that ground reaction force is basically straight up and down instead of applying a reverse direction, okay? So obviously if you have this ground reaction force that's going backwards, first of all, you're having all that force go through each of your joints, through your feet, knees, hips, all the way up the chain. And like we said, that's 2.5 times your body weight, somewhere between 2 and 2.5 times. The other thing that happens is because part of that motion is backwards when you're striking in front of you, it actually slows you down each time so that you're having to fight through that extra force, and that makes your efficiency running go down. Comparing that to someone like this stick figure who is striking underneath, that ground reaction force is slightly less, first of all, because you have less of a horizontal motion, and the other thing is it's more efficient because you aren't fighting against that ground reaction force. So now that we've kind of gone over the physics behind it, how does that apply? And what does it have to do with cadence? So cadence is the number of steps per minute that you're running. So that steps per minute is calculated basically by just, the easiest way to do it is run for 15 seconds, count how many steps you take, and multiply that by 15. It's also fairly easy if someone, like a watch like this, most of them have kind of counters to find what your cadence is. The higher the cadence, generally, the closer that your foot is to striking underneath your center of mass. The lower the cadence, or the longer stride length, oftentimes the further out in front of your center of mass that you are. So how do we apply this? So one interesting study by Leonard et al. In 2014 went over, they took a group of runners, and what they did is they found their preferred cadence. And what they did is they had them run at that cadence, and they measured the the forces through the patellofemoral joint. And then what they did is they had them run at 10% higher cadence and 10% lower cadence. And when they ran at a 10% higher cadence, the runners had 14% less patellofemoral joint force. So in other words, 14% less of force through that knee joint. And that was all by changing the cadence, which helped to bring that foot back underneath the runner. All right, so just wanted to go over some ways that you can actually change your cadence too, which is something that can, changing your gait when you're running is a difficult thing, but changing your cadence isn't something that's that difficult, and it can make some differences to where you're striking with your foot. So ideally, what we want to have is around 180 steps per minute, okay? If you're running and you find that you're somewhat below that or way below that, I like that study that I just mentioned. It'd be great to just go for a 10% increase. Another kind of cue that you can give yourself, besides just measuring your cadence and seeing where you're at, is running soft. That was another cue that they gave to runners in that study to help them improve that landing underneath the center of mass. Another great way to kind of increase your cadence or find your desired cadence is to look for a song, and if you just search like 180 beats per minute, type that into Google, you can find music that'll actually go with that cadence. And it's a good way to kind of give yourself a musical cue to actually take those steps. So invite anyone that's having some issues with some knee pain. First of all, give this a try if you're having it with your running. Secondly, if we can do anything for you here at Gordon Physical Therapy, we'd love to see you and maybe give a little bit more in-depth review of what's going on to help you out too. And here coming up in the future, we're going to have a couple more videos about kind of common running issues and some things that you can take and apply to yourself. If you have any questions or any comments about it, leave those down in the comments, or if you want to come visit us in the clinic, we can help you out too. Anyway, thanks for watching. We appreciate your time. Like and subscribe here on the page. Thanks.